So my name is Sandra Jackham. I will be facilitating the virtual healthcare chat today. I'd like everybody to know that this session will be recorded. The intent and purpose of the recording is so that we can post it to the Northern Colorado Health Sector website. And that allows folks to go back and re-listen and re-watch, and it allows folks who couldn't make it today to be able to connect in and learn about the great occupations that we're going to talk about today. So a few logistical things that I'm going to take care of really quick before we dive in is that we're going to ask the audience to just make sure their sound is muted. We love to see faces, so if you are comfortable turning your camera on, if you're comfortable turning your camera on, we would love to see your face. If you're more comfortable with it off, we are okay with that as well. We do have the chat box that is there and available for you all to ask questions. We will encourage you to interact with this session. So please feel free if you have a question to do the virtual hand raise, to unmute yourself, to ask the question or get in the chat box and ask your question. We want to make sure that you're getting the information that you came on here to hear. If you hear something and that you have a follow-up question to the answer that you heard, please feel free to ask that. And then we will be moving through with each of our speakers and making sure that they have an opportunity to answer each question. So I am going to officially welcome you all to the third Northern Colorado Healthcare Careers Live Virtual Chat. Our focus today is on healthcare careers with short-term training. This event is hosted by the Northern Colorado Health Sector Partnership, which brings together key stakeholders to promote and improve health within our communities. With industry at the forefront, we collaborate with education, workforce development, economic development, and other community partners to seize opportunities, respond to changing healthcare environment, solve collective problems, and celebrate our successes in the region. So I will be facilitating today. We also have a chat moderator, and I'd like to introduce her really quickly. Her name is Sarah. Go ahead, Sarah, and introduce yourself.
Hi everyone, I'm Sarah Rice. I'm the director of Bright Futures, and I'm here to help with the chat area. So if you have a question in there, shoot it in there. I more than likely am not the expert to answer the question, but I'll make sure that Sandra knows that there are some questions in the chat box. So thank you.
Great. So we are going to jump into some introductions from our panelists. So I'm going to start with it, and I'm only going in order of what I see on my screen, so there's no particular order, but we'll start with Miranda. Can you please introduce yourself and where you work and what your position is?
Sure. So my name is Miranda Mallett. I'm an LPN over at Columbine Commons in Windsor.
Thank you. And Sarah?
Hi, I am Sarah. I am the Clinical Training Coordinator at the Eye Center of Northern Colorado.
Thank you, Sarah. And Karina?
I'm Karina. I work for Summit Stone Health Partners at the Crisis Center in Fort Collins as a peer specialist.
Great. Thank you all for joining us today. So we're going to start off with learning a little bit about the training that you all went through. So what certifications or degrees do you hold, and where did you complete your training or degree? And talk a little bit about how long that program was. And we'll start with Miranda.
So right now I have my LPN, licensed practical nurse, and I actually got that from Concord in Denver. It took me about 10 months to get all the way through school, and then I was able to start working right after that.
And in that time period, were you going to school full-time, or were you working full-time and going to school part-time? What did that look like for you?
I was going to school full-time, and I was PRN still. So if I needed to pick up shifts at work, if they needed me, then I could come in and help them out as a CNA.
Great. And so can you talk a little bit about the CNA pathway and with that certification, what that training program looked like?
For the CNA?
Yes.
So I went to the Columbine Geriatric Education Center, and I was able to get my CNA through them. I went to, I want to say it was about 2 weeks of class time, and I did the full day, so I want to say that it was 8 to 4:30 or something like that during the day. We had 3 days of clinicals, and then we were able to take our state certification test. And again, I was able to start work almost immediately after I passed my state test for actually Columbine West. And then you get on-the-job training for at least 5 days, which is pretty helpful. You just kind of shadow an employee that's already a team lead, and they kind of run down through the ropes and show you how the job's done. And yeah.
Great. And then, so I heard you say, just to help clarify for the audience, I heard you say that while you were doing your schooling for LPN, you were able to work as a PRN. Can you talk about what PRN is, please?
So PRN is as needed. If in the facility that I'm at now, if there's open shifts that need to be covered, then the PRN or a PRN person can usually step in and cover that shift to help them out. It's 4 shifts a month, 2 weekend shifts, and a holiday, correct? Mm-hmm. And a holiday shift is what was required.
Great. Thank you very much. Sarah, can you talk a little bit about what your training pathway looked like?
Sure. So with ophthalmology, the vast majority of practices do on-the-job training, and that's how I ended up being trained. We have recently started with Front Range, a pre-apprenticeship course to get some of the foundational knowledge, because historically a lot of the training has just been, follow this person and learn that procedure, but the industry has kind of recognized the need for more of a formal training process. So yeah, my training was just on the job. Technicians were like, hey, come learn this thing, hey, come learn that thing. And that was a very long time ago. What I do at the Eye Center is I train people. They come to class with me for 6 weeks, and they have 1 to 2 class sessions per week that are half days, 4 hours, and then they're in clinic the rest of the time. And so it takes about 6 weeks to get them out on the floor and working. I hold 2 certifications. I am a COA, which is a certified ophthalmic assistant, and I am a CRA, which is a certified retinal angiographer, which is a specialty certification in ophthalmic photography. But again, both of those things were very much just working in the field for a long time and learning things.
Great, thank you very much. Karina, can you speak a little bit about the training that you went through and what degrees or certifications you hold?
Sure. To be a peer specialist, I gained a certification from the Colorado Mental Wellness Network. That's good for peer specialists, recovery coaches, and family advocates. That was a 70-hour training, and I did that before I started my current position. I'm also a certified addiction technician, which is like 1,000 experience hours and a handful of classes and a DORA certification. My bachelor's degree is actually in architecture, but I am thinking of going back and pursuing a master's in social work at this point.
Very good, thank you. And it looks like we may have a follow-up question for Miranda on the training. The question is, did the fact that you already had a CNA license reduce the length of your LPN training?
As far as me getting the education wise, no, it didn't. That all stayed the same. I can say that being a CNA was very helpful about learning about how to be an LPN. All the information, all the education that you get throughout school, you work side by side with LPNs and nurses every day as a CNA. So a lot of that stuff, it made it easier for me to understand and comprehend what it is that they're talking about as a CNA.
Great. And then a follow-up question to Karina. A question came through is do the two certifications that you hold, do they require the bachelor's degree to attain those certifications, or was that something that you can do on your as a standalone?
You can do the Colorado Mental Wellness training as a standalone. You used to be able to become a certified addiction technician without a bachelor's degree, and that's not the case as of April 1st. So now you need a bachelor's in human health science to get an addiction counseling certificate.
Great. And then really quickly again, where the question came through, where did you get your certified addiction technician certificate?
I completed the training online at Colorado Counselor Training. It's a great organization run by Kim Bappy. I highly recommend it.
Great. Thank you. So Karina, we'll start with you. Did you feel like your training prepared you for the career, and was that training cost effective for the work that you're doing?
I feel that the training certainly did prepare me for my career. It was, broad strokes, and then definitely like hit the ground running and learn as you go. I feel I didn't have a cost. So my employer paid for all of my trainings, which was really fortunate for me. I know that's no longer the case necessarily, as the budget changed pretty dramatically this last year, but I was fortunate enough to have it all paid for.
Great. Sarah, can you talk a little bit about how you feel like your on-the-job training prepared you? And can you talk a little bit about the cost of the certifications that you got?
Yeah, so the on-the-job training, I think it prepared me really well. I think on-the-job training, I think misses a lot of kind of like foundational knowledge, which is, something that I actually got after I had been working in the field for some time. So the training program that we have now with the pre-apprenticeship course or the on-the-job training that's designed at the iCenter, we try and build in that foundational knowledge before or while you're out, learning things on the job as far as how to interact with patients. The cost of the certifications, one of my certifications is through an entity called JCAPO, which stands for the Joint Commission of Allied Health Personnel in Ophthalmology. And it's, it's a mouthful.
That is.
And that test is $300 for the test. There's different ways to gain eligibility for the test, either with going to an accredited training program or work experience. And then my CRA is through an organization called the Ophthalmic Photographers Society. That one was a little bit more difficult. I had to submit a portfolio of images, pass a written exam, and then do a practical exam. And I don't remember what the cost for that was, because there were kind of costs, with each kind of bullet point on that certification. Yeah.
Great. And Miranda, can you speak a little bit about I know you talked a little about how CNA being able to work alongside of nurses and LPNs helped prepare you, but can you talk a little bit about how your LPN training prepared you for that career and what that training cost looks like?
So as far as my training goes for my LPN, I think it absolutely prepared me. There's a lot of things that you will learn in school as the base. And a lot of the things that you learn will be on the job training, which is very helpful. A lot of what I do is being able to relate with my patient and being able to do that the best way that I can. So like I said, the school will give you the foundation that you need. On the job training obviously it fills in all the gaps that are most important. As far as cost goes, I think it was pretty cost effective. I did pay for it myself. Our company does have scholarships and stuff like that, but I'm an independent person and I like to do things for myself. So, but I will be taking advantage of our company's stuff sooner or later.
Financial assistance.
That's great. And Miranda, can you describe like what a typical day looks like as an LPN?
As an LPN, so I work during the day, called day shift. So I work 6 to 2:30 usually in the morning. And we will start off usually by giving a report from the previous shift. And we kind of just go through the rundown of what happened with any of our patients, if anything changed or even stayed the same. So we will count our medications, the cart that we're on, and then we kind of hit the ground running. And the building that I work for now, I take care of about 15 people per myself. I also have about 2 CNAs, so they're able to do a lot of the hands-on care, and I distribute the medications that the patient might need, whether that be pills or albuterol or anything like that. I also do wound care as well for them. And if need be, I can talk to them or their family to give them any information that they may need if something's going on with them. I also work side by side with a physician, whether it be a nurse practitioner or a doctor, to better be able to help our patients better.
Great, thank you. And Sarah, what does a typical day look like in your role?
So it actually varies a lot in ophthalmology. Ophthalmology is generally an outpatient setting. So a typical day kind of looks like in an ophthalmic assisting role, you have a schedule for, your doctor, and you're just going to see patients and do all of their pre-testing, checking vision and certain eye health things. We don't do the traditional kinds of vital signs. We don't check blood pressures. We don't weigh people because eye care has a kind of a completely different set of information for health for the eyes. So we're doing all of that pre-testing for our physicians. An average technician will probably see 2 to 3 patients an hour for a day. In the photography role that I worked in, I did the same kind of a situation where it's outpatient and I just kind of had my schedule, but it was usually, I didn't do any of the kind of exam testing. I did all of the specialty diagnostic testing, different photography methods, and worked more independently of the physician in that role, but still very closely with them.
Great, thank you. And Karina, what does your day-to-day look like?
So I come into our unit, the crisis center, which is near PVH in Fort Collins. And I spend a little time looking at charts of the clients we have on the unit and checking emails. And then I meet with clients depending on their needs. I try to prioritize highest need clients first. In the mid-morning time, I run a therapy group, and then we all have lunch. In the afternoons, I normally do documentation and follow-up calls with clients I've had that have left the unit within the last month. I'll try and call a few times and just see how they're doing, if they need help with resources, if they're taking their medication, just really trying to be the wraparound support that clients need when they have a high utilization history of crisis services.
Great. So Karina, tell us what you like best about your job.
I think best is just the feeling of connection you get when you are able to really help someone. And, just seeing the aha moments and feeling those I don't know, they're just very intangible times of joy when people can see the hope for their own lives.
Thank you. Sarah, what would you say is the best part about your job?
I would say the best part is, very similar, is working with patients, and it's particularly in eye care. I don't think you realize until you have an eye problem how instinctually protective we are about our eyes, and particularly when you're able to give patients, when they're very concerned or very worried about what might be happening, when you're able to be a part of the good news, that's like, oh, this is a totally treatable thing or a totally fixable problem. We had a patient several years ago that went from count fingers, which is essentially you can only see your fingers about here-ish, back to 2020. And she came back to the office after her surgery and everybody cried. You know, it was just great to see that we were able to help people like that.
Love that. Miranda, can you tell us what your favorite part is?
My favorite part about being an LPN is being able to help my residents that I take care of. You learn to have such a great relationship with all the people in your facility, whether it be staff or the residents. And I love to be able to take care of them and give them what it is that they need for this last part of their journey. It's also because we take care of rehab patients as well. It is very nice to be able to see them progress and get strong enough to be able to go home and, you know, live their life as well.
Great. And let's talk about the opposite. What is challenging about the work that you do, Miranda?
And Sandra, can I jump in here as well? I just want to make sure we get this question in there from Amanda that everybody can kind of answer while they're answering your next question. Is Amanda wants to know of these opportunities everybody's talking about, is there option for advancement in the field, or do you need to go back for additional education and training in order to advance?
And let's hold off on that because I do have a question, Amanda, that will have all of the folks follow up on that, where we'll get to talking about those career opportunities and long-term career goals. So we'll hold that thought, Amanda, and we'll get to your question. But I wanted to kind of keep track on right now, listening to the best part and what's challenging about the specific roles that each of you have. So Miranda, let's have you jump in and talk about that challenging piece. And then once we get through everyone, we'll go back and talk about more longer term career goals.
So for me, the most challenging part of my job is when people are passing or they're declining. You do take care of these people for a couple years even. So you get to a point where you start to love them as if they're your own family. So when you start to see them decline and you know that they're not going to be here for very much longer, that is a very hard loss emotionally. So that, I think, to me is probably one of the most challenging things about my job. I think that because we see so many families as well, you know, we're taking care of their loved ones. And sometimes they don't always agree with what is recommended for the best care for them. So having to deal with the families if they're upset, or even the resident if they're upset, because there's a certain thing that our physicians want us to carry out, that can be a little bit difficult and challenging as well.
Thank you for sharing that. Sarah, what do you see as one of the most challenging aspects of your work?
Yeah, you know, that's funny that Miranda says that, because I worked in primary care for a very little while. And the first patient that passed, I was like, I can't do this. I was too attached and I couldn't compartmentalize it. You know, for us in ophthalmology, we very rarely see situations that are life and death. So a lot of our stress comes from the amount of patients that we see, in having to see a lot of people in a given day and having to work very quickly. And, you know, when you get a patient that is, you know, difficult because they have a stressor, they're concerned about their eyes, or, you know, patients with Alzheimer's or dementias, you know, patients that you can't help in the way that you really want to be able to help. I think that contributes a lot to our stress, and just the patient load. Ophthalmology is usually very busy.
Thank you. That's good insight. Karina, can you talk about what challenges you face?
Sure. I think one of the larger challenges is navigating barriers with clients who have been part of the system for a while. So people that usually are chronically homeless, that may or may not have a record with Larimer County Justice System. not being able to find housing, not being able to change their circumstances in a way that will help them improve their mental health. So I think a lot of times with those clients, it's like, okay, we're doing our best and it's not enough. And that's hard to say that.
Yeah, I can see that being difficult. Karina, we'll jump into Amanda's question, where she wants to learn a little bit more about opportunities for advancement. So can you, Karina, talk a little bit about what opportunities exist in your role and what additional education or training that may require?
Sure. I know that our company has just established a supervisor role. So whereas peer specialists were directly under clinical supervisors on respective teams, we now have a designated peer specialist supervisor. So that's an advancement that could be made. I think beyond that, for the most part, you do need additional certification to sort of move up. But there's a lot of opportunity within the role that I currently work. I facilitate groups here on site, and we have currently some Zoom groups that other peers lead with different topics that are like weekly meetings. And there's, being out in the community, doing things like this, just spreading the word and staying active in the community, as well as, maintaining your position.
And you mentioned earlier that you may be pursuing a Master's of Social Work. Can you talk a little bit about what those long-term career goals look like in your specific pathway?
Sure. I am currently at CSU taking some graduate level courses on a continuing education basis. 3 courses in spring, summer, and fall will yield a certificate in advanced clinical behavioral health. And then I hope to start my actual master's in January of 2022 for like a 3-year program that will be online. And at the end of 3 years, I will have a master's in social work, as well as a certificate in advanced clinical behavioral health and a licensed addiction counselor certificate at that time too.
And is it common in that pathway to have these other smaller certificates that you can earn along the way? And does it give you more access in the folks that you can treat or the folks that you meet with?
Certainly having certificates along the way is helpful. I'm not certain that it's helpful to the organization as much as it is to the individual. We do get paid more for more certification, but at this point, I would say that my education is heavier on the addiction side than on the mental health side. And so I'm sort of rounding that out with this certificate currently.
Great, thank you. Sarah, can you talk a little bit about advancement opportunities in your field of work and what additional education or training may be required?
Yeah, so there's actually a ton of ways to advance in ophthalmology. I actually have a coworker who was working as a waitress at a restaurant, and our clinical director at the time had lunch and really liked her and left her card. And now she is a technician supervisor. And she has gotten a COT, which is the second level of certification that you can get from JCAPO. So there's COA, COT, and COMT. There's lots of there's ultrasound certifications and scribing certifications and surgery certifications. So there's a lot of range in ophthalmology, and there is a lot of ways, to move up. I started, being a technician, and now I'm a clinical trainer. Our clinical director started as a technician and kind of, moved her way through things and is now the clinical director. So there's lots of ways to move up and make strides in your career in ophthalmology.
And these certificates that you're talking about, are there local training venues for that, or are they online courses?
A lot of it is online courses and self-study for the additional certifications. Some of them require case logs or portfolios, things like that.
Great, thank you. And in the specific work that you do you have any long-term career goals that you're working towards?
I have many because I have worked in ophthalmology for such a long time. I'm very interested in getting certifications for some of the other things I do, because I've gotten my photography certification. I want to get an ultrasound certification, and I want to get a certification in training, which doesn't come from ophthalmology, but there is an online course that you can take that's called Corporate Trainer Certified, which I'm interested in to help kind of up my game in the training arena.
That's great. Thank you. This is great information. Like, I'm learning a lot of new things that I never knew existed as career opportunities.
Mhm.
All right, Miranda, let's have you talk a little bit about your opportunities for advancement and any additional training or education.
So as an LPN, there's really not a lot of ways to advance except for being able to get your RN and your BSN, which obviously would mean you'd have to go back to school and get more education. But through the company that I work for, they offer scholarships to be able to help with that advancement. So that's really nice. I feel like they're willing to give back to their employees because they know that they will then give back to them, which is nice. And what was the other question?
Do you can, if you want to speak to a little bit of maybe some longer term career goals that you have in your career pathway, because you've already taken a step from CNA into LPN work.
Right. It doesn't stop here. Basically, I want to go on and get my RN and my BSN. I have many goals that I want to do as far as an RN goes. I want to, at one point I was even teaching the CNA class, so I really enjoyed teaching. So I would love to be in a situation where I would be able to help our future CNAs and be able to give back to Columbine that way as well. But yeah, I feel like as far as I want to get my RN and my BSN and just continue here.
Great. Do you see a benefit to working and learning and working and training and moving through the career pathway that way, as opposed to just sitting down and doing all your school in one shot?
Oh, absolutely. I do. I feel like there's a lot of things that you can learn that you won't learn in a book. So I feel as a CNA, again, it gave me that base, and that base I was able to learn a lot. I'm a visual learner, so I like to be able to see it, and then it sticks to me. When I'm in nursing school, when they're talking about anything, then I can relate that to a patient that I had taken care of alongside of a nurse. I feel like it's easier for me to kind of break it up that way. That way it gives me time to be able to really zone into a skill, and I don't want to say perfect that skill, but at least be really comfortable with that skill before moving on to the next. I feel that that gives you a better opportunity to be the best that you can.
Great. And so can you also talk about, I know we talked about LPN, RN, are there any other growth opportunities that exist within your organization that you're familiar with, that you know that is possible to branch off into, that may not be as direct as that RN pathway?
Well, I believe that we have scholarships that will help you as far as any medical education that you may want to pursue, I believe.
If you want to go into administration and business, to the GEC education position.
Great.
That.
Yeah. And Sarah, are there any other growth opportunities that maybe you didn't talk about in the ophthalmic field that maybe you didn't talk about? Because we heard a lot of the different certs that you have earned that other people can't earn, but just to give people an opportunity to hear other growth opportunities.
Yeah. Ophthalmology. Yeah, there, I have known techs that have left clinical practice and they've started working for device manufacturers, or they've started doing pharmaceutical sales. There's actually something called the CCOA, which is a corporate certified ophthalmic assistant for pharmaceutical salespeople that work in ophthalmic drugs and device salespeople that work with ophthalmic equipment. And there's always, supervisory roles and administrative roles that technicians have gotten into. There's lots of branches. Mhm.
Thank you. And Karina, I know you talked a lot about the addiction side of behavioral health. Can you talk a little bit about any growth opportunities toward the mental health side of your career pathway?
I think the mental health side, it veers towards higher education. I don't know that there's a lot of certification you can do, like aside from the one that I'm currently doing at CSU in advanced clinical behavioral health. That is sort of more mental health focused than addiction focused. But I would say getting a master's is probably the next step for mental health.
And then it looks like a question came in. Are scholarships specific to your company, or do you work with local workforce centers to help those that want to upskill? So I don't know if each of you are able to address this from your company's perspective. I'm going to just kind of open it up and allow any of you guys to answer this question. It looks like Joyce with Columbine has some information.
Perfect question for an HR director, but within Columbine, we definitely have scholarship programs from as we have a geriatric education center. If you did know about certified nurse aide, you actually have to pay for the course up front through us, but then the the Department of Nursing is requiring any company that hires you as a CNA to reimburse you for that cost of the class. So that's a real attraction for that first level certification process, is that it's around $1,000, but you will get half of that paid back if you come to work for us for 3 months. And then at the end of the 6 months, you'll get that other half paid back. So that's a real attraction to get that first level certificate and get it paid back. Parents are usually happy when they hear that, when they cover the cost of that, or the individual person does. We have scholarships. We also have financial assistance, and then we have retention bonuses. So for our long-term nursing staff, we've instituted retention bonuses because we want to keep our nurses. And then obviously we have scholarships to move on to that RN associate degree from maybe a Front Range Community College. They have great bridging programs to the BSN programs, and we scholarship those as well. And then once you're an RN, you can specialize in wound care, infection prevention, any type of specialty leadership role, running into the assistant director of nursing and all the way up to the director of nursing. So a lot of career pathway after you had those certificates or licenses.
Great, thank you.
The iCenter does have an educational allowance that will help pay for any certifications that you want to get.
Great, that's helpful, thank you.
Summit Stone also has a budget for education. I think everyone in my role is hired and then put through the training I was put through by Colorado Mental Wellness Network. And we also have certified addiction counselor classes that are offered throughout the year. We start them at the beginning of our budget year, and then every year changes.
Great, good information. And I'm going to ask each of you to talk a little bit about what you would recommend to anyone who is looking at your career pathway. What would you recommend for them to start looking into? What would you recommend for training? Any kind of advice that maybe you would give to somebody who's looking at your specific pathway. And we can start with Karina.
To be in my specific pathway, you need lived experience in mental and behavioral health, and you need to be living in recovery for a year. So that being said, I think the field is narrow for the people who are actually appropriate for this work. And then once you get in, I would say just say yes to all of the educational opportunities that are offered to you. I've seen the difference between where I am in my career and some of my peers who have not really pursued the educational path as much. I know they're not making as much money as I am, and I know there are some ceilings where I don't feel that way. So I would just recommend staying open-minded and keeping your education rolling.
And a question came in, I think, is this specific to Karina? Do you have to be full-time?
You do not have to be full-time. Summit Stone has a lot of part-time positions for this role. You could probably do like a 20-hour-a-week position. To get benefits with our company, you need to be 30 hours a week, or to get full benefits, I should say. So there's some incentive to be at least 30 hours, but you certainly can get a position less than that.
Thank you. Sarah, what would your words of wisdom be to someone heading down your pathway?
In ophthalmology, just get started. You know, like I said, we started that course at Front Range. That I don't know when the next date would be for that course to start. There's always jobs in the field. It's nationwide. It's a very understaffed field, so just go for it. And as far as full or part-time, I don't know if that question was just to Karina, but for ophthalmology, it very much depends on the practice. Some practices hire part-time techs and some don't.
Great. Are there, a question came in, maybe Sarah, you can address this while you're kind of still on the topic. Are there opportunities to job shadow to learn more about that career before somebody kind of jumps 2 feet in?
Absolutely. Yeah. The Eye Center definitely does job shadowing. Usually we do it as part of the interview process. You know, when you come in for an interview, we have you shadow, like, this is what our day is like, you know, to make sure that it's something that you want to get into.
Well, that's great to hear. Miranda, can you talk a little bit about what advice you would give to someone, you know, looking at CNA pathway, even LPN pathway, you know, what advice you would give?
So I feel like if you're going to become a nurse, if you want to become a nurse, and you know that you want to be in healthcare, then I would highly suggest becoming a CNA, or even before that, you could even become a PCP or a QMAP, just to be able to get your foot in the door and see if this is something that you would really like to do before you make that jump of going to school and getting your nursing. I feel like when you start as a CNA or a PCP, then you know if this is going to be what it is that you want. That way you're not taking that leap and finding out that you just went through all this different education for nothing, something that you don't really love. I feel like this is a very needy job. You know, you have to be able to want to help other people and have that compassion. So that's something that you're not going to be able to learn in school. So I just highly suggest that people at least try to get into the door and see if they like it.
Great advice. And a question did come in about starting wages. So within, and I think really to define, maybe, I don't know if Miranda or if Joyce can speak to the starting wage for CNA and LPN. And this can, you know, this can vary based on the company and the roles or responsibilities. So I think the folks here can only speak to maybe the companies where they're working. Unless you do have that information, feel free to present it.
Hi, this is Joyce again. And in regard to our CNAs, we start out after you've gone through our coursework and start working before you take your state test. I think it's around $14.50 an hour. And then you have the capability of working day shift, evening shift, or night shift. So you have shift differentials on top of that. So you can be earning almost $1 more. And then once you become certified, then you have a pay increase. And then at Columbine, all of our job roles, you have your starting wage, and then you have a 90-day review, a 6-month review, and an annual review. And then after that, so those 3 first-time evaluations in the first year, you have the opportunity for an increase. And then our LPN roles are, I think they vary off the top of my head. I don't have everything memorized. I think it's like $20 to $22 an hour. So again, they can take the shift differentials and work those additional shift differentials, adding into the wage as well. So we're definitely trying to get higher, and we are doing some comp adjustments in the middle of the year, which is competitive that we hadn't been doing previously because of all of the challenges of the nursing shortage. So.
Joyce, can you speak to whether you offer part-time opportunities for CNA and LPNs?
Yes, definitely. So we have, as Miranda had mentioned, the PRN. So you have an obligation of just 4 shifts a month, and that is a weekend shift and a holiday shift if there's a holiday in the month, and then 2 additional shifts. So that's something that a school student could actually definitely accommodate in their schedules. And then part-time is less than 24 hours a week. They are not benefited. Anybody that works over 24 hours a week is benefited all the way up to full-time status. So we do a great job with our student population and flexing their schedules. Every semester changes for students, and we realize that. So we're very willing to adapt to some level. And even with life and work with single parents and childcare, we're very flexible with our schedules to make sure that we can accommodate your changing lifestyles.
Great, thank you. And Sarah, let's have you talk about wages.
Sure. So the iCenter starts techs at $17 an hour. That's uncertified, and of course, there's raises as you get certifications. I will say I do know it varies significantly throughout the country. I'm actually not from Northern Colorado. I'm from St. Louis, Missouri, and starting wages there are closer to $13 or $14 an hour. So it's one of those jobs that varies a lot depending on where you are in the country.
Great, thank you. Good information. Karina, can you speak to the wage?
So with Summit Stone, I believe the starting wage for a peer specialist is around 15 an hour. And then, as everyone has said, with more certification comes more pay. So we here at Summit Stone have like an annual review and raise, like commensurate with cost of living. And then on top of that, like when you have a new certification, you're paid more. So
Great. So I am gonna kind of, I really want to make sure that the audience gets in any more questions. There's been some really great ones. And while you guys are thinking of those last minute questions, I would love for each of you guys to talk about maybe some of the essential skills. And this would be like soft skills and characteristics that are needed to be good at your job. Not necessarily tied to education or technical training, but really what should you have in you, or what skills should you focus on developing to be great in your pathway? And we'll start with Karina.
I would say the number one soft skill would be empathy. Just being able to sit and hold space for a person and honor their challenges. I know that it's hard for the most people who come into the crisis center, and I feel like they haven't been heard. And so just being like the person who listens is number one soft skill.
Thank you, Karina. Sarah.
I think anything in the medical field is going to require a lot of compassion for your patients. I think the number one kind of specific to this group skill in ophthalmology would be the critical thinking. Our exams have to change a lot depending on what's going on with our patient. There's exam elements that we might include or we might exclude depending on what's going on with the patient. Depending on what subspecialty you're working in, there might be diagnostic tests that you will add if a patient has a certain symptom. So there's a lot of judgment that's involved.
Thank you. Miranda.
I agree with Sarah. Being in healthcare, you most definitely have to be compassionate. And that, to me, and communication is probably one of the top 2 for me as far as being in healthcare goes. I do think that teamwork is super important, especially in the setting that we're in, because it's a team. We all take care of all of these people and help them on their day-to-day. And when if you're able to encourage them and help them, our staff and residents throughout the day, then I think that it makes everything a lot better, easier for you guys. But I would have to say that compassion and teamwork is probably most important.
Great. I want to give the audience an opportunity if you want to throw in some more questions in the chat box, or if you feel comfortable in muting yourself, you're welcome to ask anything of our panel. I went ahead and added into our chat box some information on how to follow up with questions, should you have any. And then we also have a brief survey that we would love for everyone to take a few minutes to click on and fill out and give us some information and feedback on our sessions. I do want to, most importantly, thank our panelists for joining us today. I know that it takes time out of busy schedules to sit down for an hour and share this information, but it is really important information that we all want to hear and we all need to know about. And so I want to thank each and every one of you for joining us this morning. And to the audience who have joined as well, we thank you for your time this morning, and feel free to reach out to us with more questions. And on behalf of the Northern Colorado Health Sector Partnership, I wish you all a great rest of your day.
Thank you.
Thank you.